Coming up next, it is your Pulse Radio Show. This show brought to you every week with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Good morning, welcome to December, and welcome to another edition of the Pulse Radio Show, a production of the Queen Elizabeth Hospital in collaboration with the Caribbean Broadcasting Corporation. I'm your host, communications specialist with the QEH, Shane Seeley, and we have another great show lined up for you. Remember that the QEH has been reaching out throughout the year to you to ensure that you know everything about our hospital as we celebrate 60 years of service to the country. It's our 60th anniversary, and we will continue to celebrate that into next year, 2025, as all of us will be gathering in line with the Prime Minister's theme of regathering again. So 2025 will be an interesting year for a number of reasons, but most importantly for the hospital, it will be the official launch of our new strategy, the 2025 to 2028 strategy. We have a public town hall coming up. We got to remind you about that. That is on Wednesday at 6 p.m. at our QEH main auditorium. So we welcome you into our doors. You come in around 6 o'clock or just before, get your seat and get ready to participate in what will be getting your take on the strategy. Our CEO, along with our directors, will be there to really show you the template for the strategy, the draft strategy, and you will have your opportunity to have an input. But speaking about our CEO, he's here. Mr. Neil Clark is in the building yet again as we launch December, a really great month. Everyone's celebrating Christmas. It's all about those gifts and presents and getting ready for the children, but it's a gift for the nation, this 2025 to 2028 strategy, and what it will mean as services are concerned for our valued patients. I normally say in another forum our valued customers, but you, our patients, and the visitors as well, are our family. We are all connected, and it's all about serving you. Welcome, CEO. How are you doing this morning?
Good morning, Shane. I'm doing very well, thank you.
Always a pleasure to have you on. And we have a special other guest today, her debut on radio. I got to welcome our Director of Support Services, Louise Bobb. Merry Christmas, Louise. How are you doing?
I'm fine, Shane. Merry Christmas to you too and to our listeners.
It's a pleasure to have you on. We are focusing on support services today, enhancing the support services, and then one of the big transitions for our hospital, the health information system, the electronic health information system. Just some reminders before we get to that. We have moved the blood bank. The National Blood Collecting Center has been temporarily relocated. We would have sent that notice out to the public. Of course, our media partners would have been helping us to disseminate that message. So just please be advised that effective today, December the 2nd, the National Blood Collecting Center has been temporarily relocated to the Queen Elizabeth Hospital Belleville Annex, and that's at the corner of 6th Avenue, Belleville, St. Michael. This move is necessary to facilitate essential sanitization and cleaning of the existing Gemmetts Lane, St. Michael facility. We urge the public to visit the QEH Belleville Annex, that's at the corner of 6th Avenue, Belleville, St. Michael, for blood donation services during this period. Your understanding and continued support are greatly appreciated. So we have relocated the National Blood Collecting Center to the QEH Belleville Annex. So go there. We thank you for your support, those of you who consistently donate blood, and we always welcome new donors to come in to our doors. CEO, let's look at it and do a recap.
Okay, so listeners, what we've been doing over the last few weeks is talking about the new strategy and how we got there. And we started off by producing the governance framework, which describes how we work and how we make decisions and the accountability within the organisation. We've developed a balanced scorecard that tells us how we are doing. And the next part of the journey is the strategy. Where are we going? And to draft this strategy, we looked at the balanced scorecard, which tells us how we are doing and where we've got some challenges. We looked at the staff and patient feedback we've received. We looked at previous papers that the QEH had drafted and developed. We had a staff town hall to get feedback from our staff. And we met with the Ministry of Health and Wellness and take feedback from them. We're meeting, as Shane said, on Wednesday with you, the public. It's your hospital. We want you to have your say on what you want from your hospital, and we look forward to meeting as many of you as possible at that event on Wednesday. So our strategies got 5 key domains. Healthcare delivery. Is it safe? Is it effective? Is it caring? Is it responsive? Is it well led? Infrastructure and equipment, workforce, finance and ICT. And this is digitisation, and this is probably for me my most exciting part of this, because this really takes us into the future of having electronic healthcare records and enabling doctors to be able to access patient records immediately, and also allowing the patients to actually access their own healthcare records. All in all, we've got 41 objectives and 128 initiatives identified already in our strategy, and we're looking forward to closing that down after the public consultation. So we've brought Miss Bobb along, who's leading for us on the digitisation of the healthcare records, hoping to go paperless within the next few years. Louise, I wonder whether you could just maybe give an update to the public about what this means and what this will look like.
Of course, CEO. Thank you. We consider ICT as a core business function in the modernization of our organization. We have come a long way, and much of the progress that we have made was triggered by a very eventful 2022. Around this time, actually, 2 years ago, we came under cyber attack. This hospital, like many others in this jurisdiction and others, became vulnerable at a time when we should have been making more progress with how we prevent ourselves from being attacked on the cyber.
On the World Wide Web.
Yeah, on the World Wide Web, sorry, yes. And so it was an opportunity, even though it was a very difficult time and we were able to recover from that attack. It was an opportunity for us to look closer at our posture, our cybersecurity posture, and also to look at where we would like to see ourselves progress to in a world that was advancing in making digital advancements and so on. So where we are now is that we have seen ICT, as I said, as a core business function. And we are at a very exciting stage of our development where I liken it to building a digital house for our patients. And in this digital house, our patient is the most important inhabitant of that house. This is where we use ICT as the bricks and mortar of that digital house. And if we place the patient at the center of all that we do, ICT would allow us to make the services more accessible to the patient. So the information becomes more accessible and real time. It's at your fingertips. It even allows the patient to access their own information, because you can use patient portals for patients to access their information. it also provides for improved patient outcomes. So because the information is and data is accessible and timely, it's at your fingertips, is real time, you allow the clinicians to streamline their clinical workflows and make better clinical decisions faster than they would in a paper environment.
So continue. I'm just liking what I'm hearing. I've heard it before, but and of course the CEO would have explained it. We've talked about this here on the show for quite a while, but to hear it now and putting that spin on it, and I think you should. We still want you at the hospital, but you should probably pursue a career in poetry as well. Painting that picture for our listeners about not only the benefits, but how integral it would be in terms of having them giving them full access and responsibility and personal accountability for their health. I think that's really important.
Yes, Shane, because our transformation is more than adding 100 more computers and having more applications and solutions. Like I said, we are doing this for our patient. That's the reason we come to work every day. ICT is just a means to get in there, and it helps in that it creates an environment where we do better at our services and delivering our services. And when we do better, we enhance the lives of our patients. Patients come to the hospital not to buy shoes. They come because there's something wrong with them. There's something about to go wrong with them. And they come with the expectation that we would provide a service for them that will either indicate what is happening with them and with the ultimate intention of healing, of bringing them through our system and out safely. So ICT plays a very critical role in that. It also fosters a relationship between us and the patient, an engagement that says to them that we understand that they are more than cases, that we respect them as human beings, that we have a responsibility and commitment to treating them and servicing them the way a hospital should.
And that word ICT, just for those who don't know, that's information, communication and technology, if I'm correct? Correct. And so this allows us then to communicate with our patients much better through this patient portal that we'll develop and provide them with information about their own healthcare. It allows them to book their own appointments, see when their next appointment's due, change that appointment if it's not convenient for them. It's going to bring a whole range of benefits to how the public interacts and communicates with the hospital. And more importantly, for me, it also allows the doctor to see those patient notes immediately. And he can see what's been happening to the patient over the last few contacts. As we link this system in with the polyclinics and with the private sector, he'll be able to see what's been happening to this patient as a whole. And then when he's making those decisions, he'll be able to make informed decisions, and he won't have to request tests or pathology or diagnostics that were done last week, because he'll already see those results. So it'll make the treatment much faster. I mentioned earlier too about the balanced scorecard. How are we doing? And that's where we have some key performance indicators and we track how we're doing. But collecting that with manual data is extremely time consuming.
Yes, it is.
And the data I get, by the time I get it, it's also now out of date.
Right.
And imagine me being able to see that data in real time. I can see real time what's happening in the A&E department or in outpatient clinics. I can see real time where we're up to with any of the different balanced scorecard key indicators, and we can respond then a lot faster than what we do now. So it's to me it's a really exciting journey that you're taking us on, Louise.
Yes.
And I'm really glad that you're leading it. Because you've been at the QEH for a long time, and there's not a lot that I found that you don't know about the QEH.
I am known for my institutional history and memory of the QEH.
I prefer to call it love for the QEH.
Yeah, that too. I mean, like I say to our staff, when you work at the QEH, you're a very special person, because it doesn't take much to be able to make somebody's day, or to guide, or to assist someone. All you have to do, if you're walking the corridor and somebody asks you, how do I get to social services department? And you're able to point that out, you have scored some brownie points in heaven. You have. Because it does not take much to give and to give effectively to your constituents.
Yeah.
But I wanted to add to what the CEO said about being able to use information or use data to turn it into information. And that's one of the other exciting things about having a health information system, the data analytics, what happens at the back end. So you have all this data, it's at your fingertips, it's real time, you can see it, you can manipulate it, you could assess it. What do you do with it? That's where population health comes into play. That's where you use the information, you can see trends. You can see if a certain cohort of society is now presenting with high blood pressure, hypertension. Where are they coming from? Where do they live? Is that an indication of what's happening in their particular community? That is the treasure that hides behind ICT. That is what we are going to unfold and unmine for this small country.
I can see other elements of the public and private sector doing some data mining with us and using that to correlate instantly instead of using surveys from 2016 and 2015.
Yes.
They're going to be using to-date data to get up-to-date surveys so that then we can respond and monitor and respond to these trends. Let me apologize to our listeners. This has been a very interesting conversation just to start, and it continues. You can call us at 434-1007 or 434-1070. You can also send us a WhatsApp at 434-1007. And we have a caller. They're waiting on the line. Welcome, caller, to the Pulse Radio Show. I expected this. I expected you. Merry Christmas. Merry Christmas. How are you doing?
Well, I think this call is more fortuitous and auspicious on this fantastic, magnificent, and mighty local occasion on the town hall. I'm so looking forward to that on Wednesday. You don't even know, Shane.
Are you coming?
I met you last time, and I'm going to come again. And I really think that it's important that we have the interactivity with our public. It is one of the most important, vital aspects to the critical, not only the critical care, but the aspect of the leadership that the hospital is bringing to this country and to this region as the foremost fantastic institution that we all are fans of for our health's sake. Now, Shane, I have a couple of questions this morning.
Go ahead.
Thank you. The first question has to deal with the philanthropy department and the aspect of using the data that you do have, and I know it's a lot, in terms of the history. I know that CBC has a program called From the Archives. That's a great program.
Yeah, done by Sherwood and his team.
Thank you very much. And I think that the hospital can do. I think that the Queen Elizabeth Hospital can do something of the same, where you get data from your today, like say today, 50 years ago, and you use that for tourists, or you use that for tourists for people like me who want to see where the hospital was on their timeline at that point in time. And in terms of the nice lady who is there, Miss Louise, that you can, people that know about these things, that know about health of the calendar, what was done for patients at that time in terms of their support, their ability to heal, and what is done for the future. So what you do is that you're able then to create what you call it, a menagerie, yes, a menagerie of the past, the present, and the future in tours to that hospital, in tours to different facilities, but you're using the data that you have to create for the philanthropy department that every time somebody comes through there, they're taking, if they're not busy, if they're waiting, they can take a little tour, and they can use your data, your history, to chronicleize their journey. Oh, I went here 20 years ago, and I was pregnant, and I got my son 20 years ago here. And let me give the hospital $100, because I think that in terms of touring that department there, the pregnancy unit, that I think this was fantastic. in terms of not only my memory, but in terms of what the hospital is doing now to update that care that I have. If I want to have a son now today, and I want to have this opportunity now to not only as I have gone the tour, but to be able to facilitate that kind of
I think I got
arena,
you.
an aspect,
Yeah.
a possibility of the history of the hospital, and where it has come to the service of the people of this country, and where it has come for the philanthropy department, where it has come to people to sponsor the different units and get that money flowing, Shane.
Right. So I think I have you, and that money that you're speaking about has already started to flow. Philanthropy officer Gay Howell has been doing a great job at connecting with partners not only here but in the diaspora as well. So the diaspora has been really big in helping us, and very soon you'll see a philanthropy corner being showcased on our website and on some other publications that we have planned. But yes, philanthropy has been really good to us as far as the tours are concerned of the hospital. I can see a future where we have a closer relationship. We've seen it happen already, and I know there are some other plans for a school showcase where some of the students come in, see some of the job opportunities that are on offer. But I think where our caller is going there with wider tours for people to see a bit more of the history of the hospital, what it has been all about. We are celebrating 60, so probably next year may be the perfect opportunity to do some of that. Let people see the history of the hospital.
And I think also linking this back, the philanthropy back to the health information system, we've been very fortunate that some donors have done a lot of work and donated a big piece of equipment for us and been really helpful, and we're very grateful for that. But it'd be good if we can now start to provide back to them how well that piece of equipment that they offered to us was used. Because this will be collected automatically through the health information system, and will be very easily to be able to provide back how many people used that equipment, how many lives they saved, and that should hopefully then encourage them to invest further in the hospital. So I think it's really important that we acknowledge our gratitude to these donations and provide them back with the details of how well used that donation has been to the public of Barbados.
Yeah.
I also like the callers call for us to chronicle where we came from, where we are now, and where we're going. That is an exciting component of our development. And for those who are not aware, the hospital was built with $8 million.
Wow.
On what was
Do you think
formerly
we could build a new one for that
$8
price?
million. We could probably outfit a ward.
One piece of equipment might cost $8 million.
But we won't be able to build a whole hospital with $8 million. But the hospital was built on the residence of the deanery 60 years ago. And it was built at the time for what was occurring in population health at the time. It was for the maternal and child health, and that's why the mural at the time is of the women with the child.
I always wondered, and I always say they leave out the men.
Yeah.
They always leave out the men.
Yeah, well, it was about for the men, it was about for the women and the children at the time.
Wow.
And here we are 60 years later. We've progressed very well in our maternal and child health program in primary health, but we are under the scourge of chronic non-communicable diseases.
Yeah.
And here we are again about to transition not only in ICT but in clinical services, because on the cards is the development of our Enmore and our Enmore site again, which was built in 1955 as the go-to healthcare center. And here we are now again looking to make another transition on that particular site, and there is where we can link now where we came from and where we are going in the next 5-10 years.
Yes, it's a site steeped in history, and we do appreciate what it has done not only for the people of Barbados but the people of the region as well and further afield. We have another caller here on the Pulse Radio Show. Good morning, caller, and thanks for Kamal for giving us that food for thought. Let's go on to another caller. Good morning. Welcome. What's your question or comment?
Good morning. I would like to compliment the hospital. I was there for like a day with my father, and I was very impressed with the level of cleanliness that existed. Well, I was there for 10 hours. About 4 different times people came in, the orderlies came in and cleaned the area, sanitized. The wait was long, but I couldn't understand because while I was there, they had quite a few emergencies. And I can understand the wait, but I really must say the service was very good. You can stop doctors and ask questions. And people must understand that you pay to go to a specialist, and you have to wait 3 and 4 hours before you get that service from the specialist. You leave work for 12 o'clock appointment. You have to leave work at 11. When you go there, you don't see the doctor till 2 or 3 hours after. But I got very good service. The wait was long. I can understand that. But I really appreciate it.
And Miss Bobb actually is responsible for the cleanliness of the hospital as well as the digitisation of the hospital. So that's a compliment to you and your team.
I am so humbled and appreciative of your comments, and this is a big elevation to the work that our housekeeping department has done and has been doing over the years. We've come a long way. It wasn't always that way. And I assume you're talking about the accident and emergency department, which was just recently expanded. And had we not gotten help from HR and expanding the workers, the general workers and staff, you would probably not have experienced such a good experience in the environment. So it's because of having the resources, and not only having the resources, they should know what they're supposed to do. And our housekeeping department, under the leadership of their managers and those of infection prevention and control, operate under particular standards and protocols. So that is why you would see intermittently staff coming through, making sure that the place is clean, making sure the walls are carbolized, making sure that the bathrooms are clean. And I think most people understand that while the hospital is aged, it's a very aged plant, and we do our best to maintain it, we do a good job at keeping it clean. And we've gotten those compliments from persons from the outside as well, external persons who come to do business with the hospital. We've done a good job at keeping it clean. There's no longer that scent that we used to get decades ago, and that's because we have increased our standards and improved on how we approach cleaning.
And there's also a mention about waiting times for outpatient appointments. And again, with the health information system and the use of the patient portal, we should be able to transform this. You should be able to choose the appointment that best suits you.
Correct.
If you're working, you might want to come at the start or the end of the day. If you're not working, you might be happy to come in the middle of the day.
No, I was talking in terms of waiting at the accident and emergency, not even having an appointment. When you walk in, I can understand you would have to wait because of the different emergencies that you experience.
Yes, as they
Sitting out
triage.
there, I would not understand. But when every couple of half an hour or so, 50 minutes, you see the ambulance services personnel coming in with somebody, so that's what I meant. I'm not talking about the appointment, but I'm talking about right there. So obviously, they will be looking at the people who are more serious.
Yes, and of course they triage the patients as they come in for the more serious ones who go straight through.
Right.
But of course you've probably also heard that we're getting diagnostic equipment into the A&E department, which means they'll be able to do the diagnostics much faster, so everybody flows through the system much faster. And also, again, with the health information system, they will be able to see your record as you arrive and identify anything that's been happening with you over the past few months that might give them an indication of what treatment they need to start you on earlier. So again, this will help people move through that system faster. So I do look forward to Miss Bobb helping us digitise the hospital, and that will have many benefits to the patients in relation to reducing the waiting times, ideally where we want to be. And I always say this, we should believe and aim for nobody waits for anything. There is no value when you're waiting for a service. The only thing you should wait for is if it takes that time to do the test. It actually takes 30 minutes or 40 minutes to actually physically run that test, then that's a 30-40 minute. But you're not waiting for something, the test is happening. But once that test is completed, then the next thing that's needed for you should start immediately. And what we need to do is identify all those different areas where the weight is of no value, and push those weights away. And having this information system will allow us to track where have we got people waiting when nothing's actually happening to them. And then what can we do to change that and put the services in the right place so they're not waiting unnecessarily, and move them through. The faster we can move a patient through the A&E, the better for the patient, and equally the better for the staff, because they don't want to have patients waiting and have patients asking questions about what's happening next. So to move this forward with a health information system, we will see great benefits to waiting times.
Caller, one more thing. If you have any input in terms of how you think that we can address any of these situations, I invite you to come to our QEH Public Town Hall on Wednesday.
I won't be able to, but I would like to... Can I get a number to contact somebody?
Oh, yeah, you can. 536-4800. That's our patient advice and liaison service. 4800. Our patient advice and liaison service, our help desk, or your hospital pal. And you can call that. Any question you can ask about your medical condition, about using the hospital in general, you can get all of that information there.
Okay, thank you so much. Thanks again for the service provided.
You are very welcome, and we will try to keep that standard up. That's what we are aiming for: high standards of service delivery to you, our patients, to your visitors, and to you who use our hospital. You're listening to the Pulse Radio Show. We'll take a quick break and be right back.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're back with us here on the Pulse Radio Show. A big thank you to Rohit and his team at MedSafe Medical Supplies Limited for their continued support of the Pulse Radio Show. Without them, we can't be here. I mean, we can be here, but we got to thank them for being a part of this journey of educating the public and really bringing the hospital into your home, letting you know how you can access the services of the hospital and how we can better serve you. Let's go straight back to the phone lines. We have another caller there as we speak about our support services and enhancing them under the 2025 to 2028 strategy. Good morning, caller. Welcome to the Pulse Radio Show. How can we assist?
Good morning, Mr. T.
Hi, good morning. How are you doing?
How are you?
I'm wonderful. Merry Christmas.
I'm just calling to ask a question. I have a nephew that linked their same Saturday.
Right.
He get injured at work with his son. Them saw the hand and say he has to go to service. Therefore, that he's still in accident emergency. Every minute you're asking a question and you're getting the wrong. I want to know. I'm saying that I'm waiting on a bag for him to go upstairs. Right now I call him. He's still in accident emergency. So I want to know if you could do a little thing for him, please.
Well, I will tell you to leave your name with our producer. That's one, so that we can get into contact with you again. The second thing I would do is tell you the same number I just gave out for the patient advice and liaison service. You need to call that number and let them help you to understand what is going on as far as your nephew is concerned. That number is 536-4800. You may not be the next of kin though, so we don't just give out health information on a patient.
I am his next of kin because I am in charge of him.
Well, perfect. That's even better.
That number that you give me, I still get in the hoops with it.
No, you're gonna get the hoops with that.
I leave down there this morning and I had to end up going to work, and it's unfair that you down there since Saturday. Nobody ain't telling you what's going on. You're getting when one shift change, the body ain't know what's going on with him. So it makes no sense that I'm keeping him down there and still You ain't getting no headway.
Right. So while he's down there, I'm assuring you he will be
He
receiving.
gets him from. He went Sandy Crest. Sandy Crest sent him from down there up at QEH. That's next Saturday.
Right.
And he hands numb.
Mm-hmm. So while he's there, he will be receiving in accident and emergency. He will be receiving treatment. But what I need from you is for you to leave your information with the producer, Andre Harewood, so that we can give you a call back and let you know what is the next step, what is the next course of treatment for your nephew. As you said, you're the next of kin, so we will get that information to you. So please leave that number with our producer and we will reach back out to you. Okay?
Okay.
No problem. And we apologize for the inconvenience. And I'm telling you, our doctors and nurses and our medical team are working to make sure that your nephew is okay.
Thank you.
You are very welcome.
The
CEO wants to say something to you.
And just to pick up in general about
Okay.
A&E. So A&E is a challenging environment for patient flow. So patients come into A&E, and if they're waiting for a bed at the end of this, then we've not only got the flow through the A&E department, we've got flow through the beds and the systems. And so A&E, we know recently has been busier than normal. We've seen about a 10-15% increase in the number of arrivals coming into the A&E department, which puts a little bit more pressure on there. And we've also seen, compounded with that, a number of people waiting to move out of A&E into beds. And so each morning there's a daily huddle where they come together, all the different teams from across the hospital come together and identify how can we move patients through those beds. They've recently just drafted a new discharge policy, and this is about planning for, even before somebody arrives on the bed, planning for the discharge. So we don't have people, as I spoke before, about waiting unnecessarily. Everything's planned all the way through. Now again, trouble with a manual system, it's very hard to capture what's happening with every patient, where are they currently in their patient journey, and what needs to happen next. And again, the health information system will support us with this by being really clear that somebody's been admitted, but there is no estimated date of discharge. Somebody's due to be discharged home tomorrow, but the take-home drugs have not been prepared already. So we've got a lot of work to do on getting what I call the patient flows in the system improved, and ensuring that patients are not waiting for anything other than treatments that they're actually having. And I'm really comfortable and confident that with the health information system we will see some significant changes to this. But in the meantime, the teams are out there now manually searching for who might be fit to discharge home safely, to create more space for the patients in A&E to bring those up, but it's a manual, time-consuming task. Going forward, that will be automated. We'll be able to see this information automatically on the computer systems. Where are the beds? Which patients are due to go home? How can we prepare somebody to move up? How can we prepare somebody to move out? So there's lots of work to be done still on improving patient flows. And if we can improve patient flows on the beds, that will also support the A&E department in the same way we can support diagnostic services to the A&E department.
Yeah, and while we do that work, that's why we initially sent out that surge notice, the advisory to the public, reminding you that you have options, especially if you're not serious. And you can call our patient advice and liaison service, again 536-4800, and you can use regular or WhatsApp calls between 9 a.m. and 12 midnight. Our medical personnel there, they'll be able to give you an initial assessment and provide some advice on your next course of action. You can also seek treatment at our 24-hour Winston Scott Polyclinic, that's at Gemmett's Lane, St. Michael. Or please, in the interim, if you're not serious, contact your private medical physician. But life-threatening conditions will continue to be seen and treated immediately. Other individuals, you may have an extended wait. And we will continue to provide you those updates from the AED and across our hospital right here on the Pulse Radio Show and on our website. That's www.qehconnect.com, and you can also go to our social media pages on Facebook and Instagram at QEH Connect. That's our handle to get updates there.
Yeah, Shane, I wanted to pick up on something you just said. You said it twice, actually. If you're not serious, to someone who is experiencing in what to their mind is an emergency, a medical emergency, it is serious. They would consider it to be serious. But imagine a world with the HIS where you can go onto your patient portal. that patient portal could take you specific places within the hospital, and when it comes to more interoperability with the wider healthcare sector, to see which facility you should go to based on what you are experiencing. Right. Which and if it is indeed based on the information that's provided to you that you need to go to the acute emergency care at the Queen Elizabeth Hospital, A&E, then you'll be able to see what the wait times are, and you can make more informed decision about your own health. So this world that we are about to enter in is a game changer for this country when it comes to healthcare. It has the support of our authorities at the highest level, and I am very excited that we are living in a time that we get to see this watershed moment for the hospital.
Indeed.
Yeah. Imagine not having a missing note, because all the teams can see the patient's information at the same time. So bed management knows, okay, we have X amount of persons in any that needs to be discharged. The clinicians know, okay, well, I have to increase my rounds for today so that I could make more safe discharges, because you don't discharge any and everyone. Once the discharge is safe to be made. Pharmacy knows, okay, I have to increase my take-home medication for the day. All the teams work together because ICT, information, communication, and technology, has layered that digital house in a way that the patient remains at the center of our focus, and we do all that we do for the patient.
And as a major part of that digital house, those people who reside in it, a number of them will be our staff, especially those who work in medical records.
Yes.
And there is a plan to also, as we enhance our patients' capability to understand and better manage their health through this health information system, we are also going to upskill our workers as well.
And what the public may not know is that about 90% plus of medical records staff have been trained in health information management. BCC was conducting that program for quite a while now, but the reality was that they came back to an environment full of paper. We're not able to use the skills that they had learned in some respects. So now this is an opportunity, as you say, to upskill and upgrade this cohort of staff who will become managers of the information, and they will become the super users of the health information system. So
and I've already asked,
exciting.
And I've already asked Louise to start looking at taking some of the staff out of medical records now into a health information management team and start preparing. So whilst we don't have the data yet, we can start thinking about how will we structure that data, what will those data definitions be, and how will we use it. So we don't have to wait until the software arrives next year to start that journey.
Yes.
And we can start to migrate some of the staff away from the manual records to start getting ready, setting the early preparations before we remove the remainder of the staff over. Of course, medical records, the actual physical paper, we need to digitize all that.
Yes.
And I know you have a plan for making the paper become electronic.
Yes.
And then as I move along my journey to going paperless, you might not be aware, but we spend nearly $1 million a year in paper, photocopier toner. So all these things in the future won't be needed. All those things won't be required if we can get truly paperless. But I know you've got plans to start to digitize the records, which will mean then also that the record libraries will be made available back to the hospital for more treatment spaces. We know we've got challenges with outpatient spaces at the moment for treatments, so we'll have that available. I think we've got off-site medical records that we probably pay rent and storage for that we will no longer need in the future. So many exciting things going to happen, and many benefits that come by having this. And just maybe, Louise, the plans for making paper records become electronic records.
Yes, CEO. So we've about to engage with an external provider to help us with the digitization. Digitization of health records is a very specialized
undertaking.
Service and undertaking, yes, because as you know, most of us know our medical records, our notes, are not just A4 paper size bits of paper. There are all sorts of kinds of records. There's all sorts of charts. There's blood samples and results and all shapes and forms and sizes. And some of our records date back to when we opened the hospital. So some records have paper and that's very difficult to deal with. And so the digitization calls for specific talents to transfer and convert paper into an electronic form. We expect this project to start somewhere before the end of the financial year, which ends in March, and it is one of the precursors to the implementation of the health information system.
Right. It would have been much fun for a doctor turning on a new health information system and finding there's no information in there.
Correct,
it's like buying your son a PlayStation at Christmas.
No games.
Without any games.
Yeah. We are looking forward to what that outcome is going to look like, how it's going to feel. And those are the kind of things that we, because preparing our people for the change, both hospital staff and the public, is a critical component of transition. And having the records digitized, no longer you're working with paper, everything is at your fingertips, is important cog in the wheel of digital transformation.
And data quality wise, because the public will have access to the patient portal, it allows them to see what's been put onto the medical record. And if something's on the medical record that they don't recognise, then it allows them to alert us and say, I don't know what this relates to. So it allows us to make sure our data is as accurate as possible. It also allows them to see who's accessing their records, which is really important, because people might be nervous that who will see my records. Well, every time your record's accessed, your patient portal will tell you that your record was accessed. So if you've been to A&E, you wouldn't be surprised that A&E open your patient record. But if you haven't been anywhere and medical records or an outpatient clinic opened your record, then you'd rightly be concerned as, why was my record opened? And again, you can create an alert that we can go and investigate, why was your record opened? Nobody had right to open your record unless you've given permission to do so, or unless it was an emergency and you was unconscious and they did so. That's your record, and only you can give that permission for somebody to open it.
Yeah, and we got that question a minute ago coming in on social, so it's good to have you answer that in one go. Yes, there are protective mechanisms in place so that your health information will be secure. And I mean, if you have any more questions as we go this paperless route and go into an era and an age of digital transformation, you can come and share your concerns with us on Wednesday at the public town hall. That's at 6 p.m. Remember, please be there on time as our CEO unveils the 2025 to 2028 strategy, so that you, the average Barbadian out there, can give your input. What do you want your hospital to look like? This is your opportunity to have a say as we embark on this new journey together. So please come to the QEH auditorium Wednesday. That's December the 4th. Join us at 6 p.m. for what will be an interesting discussion at our QEH auditorium. So you just come and we'll facilitate you. We'll have a good time. And by tomorrow, we have a press conference as well to talk a bit more about the public town hall and what Barbadians can expect. We will let you know about that way to join us virtually as well. So listen out for more on that. As we wrap up today's discussion, looking at the health information system, looking at these upgrades to support services, and where we've come from, Louise, because as the CEO rightly said, you were there for the earlier part of the journey.
Old, Shane.
No, you're not old. Not by any stretch of the imagination. You are.
Hang on. I got some years on me.
but you've been there. As we talk about this transition, how happy are you to see it happen? at the place where you have given blood, sweat, and tears to over the years?
I would not want to be anywhere else. I mean, there are days where it's a little difficult because you are providing a service to persons that is specialized, no matter what area you are in. I represent support services. Without support services, the surgeon could not perform in surgery, because if the theater isn't cleaned, he can't perform the surgery. If the telephone operator does not answer the phone, you can't make the connection from outside to inside. If the laundry does not launder the linen, you can't put the patient on the bed. And in each of those areas, so much development in terms of the protocols and service and procedures, how they have been enhanced over the years from when I started, in terms of the development of our people from when I started. Ophthalmology, yes, is a specialist area, but it has expanded so exponentially to have about 13 or so specialty areas in ophthalmology alone. Our cardiac services was developed in the 80s, and several other areas of development that has made the QEH who we are today.
Yeah,
do we have a ways to go? Yes.
It's a work in progress.
It's a work in progress. Do we stumble at times in terms of how we engage with our constituents? Yes, but there's always room for improvement.
You know what? Just then you said that you know there's nowhere else you'd rather be, and you feel excited and proud. You know, a lot of staff have said that to me in the organisation. They feel there's a change coming, and this is going to be the biggest change probably since the hospital was built.
Yes,
because this is going to be change it as much as having a brand new hospital 60 years ago. Having this health information system, and don't get me wrong, it'll start to implement next year. It will take a year or two before it gets itself fully bedded in and up and running properly, but we'll start to see benefits early. This will be a significant change to the way that healthcare is provided for the population of Barbados. And we're very lucky, Louise, me, you and everybody at the QEH, because we get to bring this to the population of Barbados, to the public of Barbados. And imagine in 2 years' time, when everybody's saying, this is so different, this is so much better, and that we were there, we were part of that journey of bringing this change in, this much needed change, and people can feel proud to work at the QEH, and the public can feel proud about the QEH hospital providing them the best services possible. So we're on this kind of cusp of a big change, and we have to ride this change through now with our staff and with the public, and we hope that we can bring everybody with us, and then in 2 years' time we're sat back in saying that's going pretty well. We've seen some good changes, and we can pat ourselves on the back and work on more changes, because this will be about forever change. Forever change.
And we cannot do it. None of this is possible without our staff, because a computer will not turn on by itself. Well, not yet. The AI thing, I don't know, but the hospital is more than the bricks and more than the equipment. It is about the staff and the commitment.
And the staff are just so committed. I just sense within them they're ready for this, and I'm really pleased that I'm really proud and pleased to be the CEO of the organisation where the staff are ready for this change.
Indeed. We have another question coming in from WhatsApp before we wrap up today's radio show, the Pulse Radio Show. Good morning. I'm traveling for a medical procedure in February. How do I get my medical history from the QEH to the surgeon overseas?
Okay, so medical reports or medical notes can be made available to the patient. It's their information, and it is done through a request through our CEO to the Chief Medical Records Officer. There's a cost to the provision of that service, and it's at $375 that must be paid before either the report or the notes are released to the person. So you just make the request through the CEO's office to the Chief Medical Records Officer.
And that's where we are today. But again, Imagine the future.
Yes.
It'll be on your phone. It'll be in your patient portal. It'll be in your own health records. It's there available for you straight away.
Yep.
No letters coming through. No paper letters coming through to me. That get signed and passed to somebody else. To stamp and sign and pass to somebody else. Gone. All those things will be history.
Yeah, and if you have any further questions about that, 536-4800, patient advice and liaison service. Remember our public town hall, the QEH public town hall. That's on Wednesday at 6 o'clock, the QEH auditorium. You can join us then. I really want to thank our CEO, Neil Clark, and our Director of Support Services, Louise Bobb, for joining us for today's Pulse Radio Show. I'm Shane Seeley. We look forward to seeing you on Wednesday at the Public Town Hall, where you get to have your input in the 2025 to 2028 strategy, the new way forward for our hospital. Goodbye for now.
Join us again next week, Monday, for your next Pulse Radio Show. The QEH Pulse Radio Show brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.